What methods has your organization employed to engage patients, families, and the community in setting quality goals and eliminating patient harm? Do you have an active patient and family advisory council that participates in your organization's improvement efforts? How does your organization work to educate patients about their health and involve both patients and their families in quality improvement efforts?
I think that health systems and boards are beginning to get wise to the fact that getting feedback from patients and family members is a valuable tool to pushing our organizations to get to a higher level of quality.
Seeing our organization to the people that we serve, the patients and their families, is an important aspect of us performing to our highest potential. So what we try to do is we have patients on each one of our safety committees. We have a very engaged patient and family organization that helps us make our decisions. We have patients that sit on our quality committee, and we start each one of our board meetings with a patient story. We try to make sure that patient story is balanced. Tell what went well, what didn't go well, where we have opportunities for improvement, and tell it in the patient's words. We've heard some very, very interesting things about our organization that we would not have known seeing it from our own eyes. We hear great things that we have missed through our own eyes. We hear challenges that we would have missed through our own eyes. A patient experience, a family experience is an extremely powerful way to gauge the performance of your organization.
We engage patients and families in improvement work, in setting quality goals and eliminating harm by finding the right patients, finding the patients and family members who really have an interest in doing that. And believe me, it's not hard to do if you ask the right questions. There's a lot of patients and families that are really interested in seeing their local hospital be the best hospital it can be in terms of delivering the highest quality and the safest care. But you have to ask the question, you have to start that discussion. And then you have to look for skills, teamwork skills, listening skills, and we're always surprised by finding patients and families in our community who have more skills than we thought they might have.
Now, hospitals are often going on and trying to actively engage patients and families, not just in asking them direct questions about, how did things go? Did your doctor do this, or did your was the room set up? Those kinds of questions, but actually actively engaging patients and families in patient advisory councils, choosing the right patient and family member, right? Someone who is going to give you honest feedback, and asking the right questions are important. How would you do this differently? How could we improve the operating room process? How could we actively engage families in trying to reduce the overall anxiety of what happens in the hospitals? Those kinds of questions are much more direct and are designed much more for open feedback, where you're much more likely to get suggestions that could make a bigger difference.
We have a couple committees that we have involvement from the community by placing community members on those committees. We can't be all things to all people because there's only 7 members on our hospital board. So it helps us think more strategically, and also gives us good input from the community and what the community would like to see.
But as a board member, as a governing body, if you don't have that perspective of what it's like to be a patient in the hospital, you're missing some very important ingredients. And I think that's why it's absolutely essential for governing bodies to reach out to patients to make sure that they're fully representing what the community sees in the institution and what each individual patient and their family sees when they come in for services. To function in a vacuum without adequate feedback from our patients, without direct feedback from our patients, we're sort of just guessing in a lot of ways, right? If you engage people and if you ask them, they'll tell you very readily. And it's often not the end point that's the most important thing to do. It's all of the things that lead up to that event, right? Because very often when somebody has an adverse event in a hospital, you could see, if you actually looked at a time and motion study of all of the events leading up to it, that there are things that we could have intervened on to prevent that from happening. So it's really about figuring out how to go upstream, and ultimately the most upstream is our patients' perceptions and our families' perceptions of what's going on.
What we've also seen is just a shift in the conversation about accountability. That's been really, really interesting. I think when we think, on the provider side of accountability, we think what patients are talking about are justice or perhaps compensation if something goes wrong. What we've seen in the conversation at our board when we brought patients into that conversation is accountability for them is for improvement. If they see something that hasn't been done right or perhaps an event, they want to know what the hospital is going to do to prevent it in the future. And it's a whole different notion. It's very future-oriented. It's very encouraging. It is going to help a hospital become better.
I think the engagement of families and community as awareness is so important as we continue to deal with quality. We feel it's so important to get that feedback, and our patient satisfaction scores continue to be high, and I think that's the direct result of the success we've had in communicating with family members to let them know what the expectation is for us and have we met that. And when we don't meet it, it's something that, again, that we hit head on. We want to make that improvement. We want to make that stay, whether it's my mother or your mother, the best stay possible. We want to provide them with the top and best medical service while they're in our facility.
Now, you can do it by actively bringing a patient in to tell a story about what happened, either good or bad, right? Because it's not just enough to just bring patients in to give you accolades about what's going on. It's actually much more valuable, if you find someone to tell you about the things that could have been better in a way, or maybe if there's something untoward happened, what was that like? Those are the very powerful things that can actually capture a board's imagination and really get them focused on, well, what are the kinds of things we can do as a board and as an institution that would have prevented that from happening? We actually go out of our way to try to get families and patients to give us a real-time check and balance. Did the nurse wash their hands? Did the doctor do this? If the patients are the ones who are going to suffer from those complications, we really absolutely should give them the clues as to how it could be prevented. And they should be active participants in that prevention. This whole area of patient and family engagement, it's very easy. Most people think that they do it, right? They think, oh, of course, when somebody goes home, we give them discharge instructions, we spend time with them, we go over their medications. And then when you actually go back and call, a day later or even the same day, and you sort of ask your patients and their families, well, what's the plan and what are you doing? What kind of medications they're on? There are so many times when, that information is just not transmitted. So many hospitals are beginning to really examine how they do patient education and how that interaction goes. And then I think most people are really beginning to understand that it's just so critical to not just think that one interaction is enough, that it's multiple interactions and multiple back and forth that really makes a bigger difference. A lot more follow-ups to that new teach-back methods that people are using to really get family members and patients to really understand what the game plan is just absolutely critical.
So I would really encourage every leader, every healthcare leader listening to this to look again at what you're doing with patients and families, engaging them in your safety and improvement work, because it really is the next wave. And it's a matter of true belief at this point in time. Hospitals that have done this see huge benefits of it. We're just gathering the evidence. So I can't give you an evidence-based reason to do it, but I'll tell you that the hospitals that do it and do it well find that they learn things from patients and families that they don't hear from their own staff. They capture that often family manager perspective of a patient as they go in and out of healthcare that's so important to helping a patient get good outcomes. And I think what also hospitals don't really realize is just how eager many patients and families are to help your hospital be the best hospital it can be.
The patient voice must be heard in the boardroom, and that must include both positive and negative patient stories. Boards and hospital leaders should engage patients and families in learning about the care process and identifying opportunities for quality and safety to be improved. Boards should support and encourage engagement that helps educate patients, families, and the community, allowing them to be active partners in their care.